Hello, is your heart healthy or is it in trouble? Today, I'm going to talk about the 7 signs in your body that may indicate your heart is not 100%. Cardiovascular disease is the #1 killer in the world. I'm going to break this video into 3 parts. The first part is about the 7 signs that you can see, signs that something's wrong and that you should look for when checking for heart problems. In the second part, I'm going to talk about the 7 classic symptoms, what you feel when your heart is not doing well. Could you or a family member be feeling them? And finally, I'll give you some valuable tips on how to avoid heart problems in the future. It's going to be a very comprehensive video, so stay until the end. I'm sure there's a lot you haven't heard before. But first, please like the video. The more people like it, the more YouTube will distribute it to people who don't have access to doctors or hospitals. Also, please share the video with your friends and family. Many lives can be saved with your help, so share it. Do you have a heart condition or think you might? What part of the world are you from? Right below. Here we go. What are the 7 signs to look for that could indicate you have a heart problem? What are the signs that you can see? 7th sign, I'm sure you're going to start looking at people's ears more carefully from today on. Why is that? Because there's a little sign in the ear that could indicate that the person has a blockage in the arteries of the heart, the coronary arteries, or the carotid arteries. Seriously, this is true. Back in the 1970s, Dr. Sanders Frank noticed that many of his patients with angina, chest pain, had a diagonal crease in their ear. He called this the Frank's sign. What is the connection between the heart and the ear? One theory is that the same factors that damage the inner lining of the arteries can also cause this crease in the ear. So does everyone with Frank's sign have a blockage? No. Out of 100 people who have this diagonal crease in their ear, 30 have nothing. It's just a sign of aging. The younger the person, the more likely it is to be a sign of a coronary or carotid blockage. So if a person is 40 years old and has Frank's sign, we have to be more attentive than someone in their 80s who is probably just old. The sensitivity of this sign is low. In other words, out of 100 people who have heart blockages, only 40 will have this sign. So you can't celebrate just because you have a smooth ear. 6th sign, hair loss on the legs. Hair loss, first on the shins and then on the thighs, can be a sign that you have peripheral arterial disease, clogged arteries in the legs. Because atherosclerosis is a diffuse rather than localized disease, if you have a blockage in your legs, you may also have blockages in other arteries in your body, including the coronary arteries that supply blood to your heart. Most people with peripheral arterial disease do not realize something is wrong until the atherosclerosis has progressed. Why do they lose their hair? Because hair follicles need nutrients to grow hair. You need good circulation. If your arteries are clogged with fatty plaque, you don't get enough blood and oxygen. In addition to losing hair on the legs, people may experience smoother, shinier skin, cold skin, and reduced nail growth. But let me emphasize that leg hair loss can happen for other reasons, not just peripheral arterial disease. There's genetics. You can lose hair just by rubbing against your pants. 5th sign, xanthelasma. You may have looked at someone's eyes and noticed a yellow plaque on the upper eyelid. This is called xanthelasma. It doesn't hurt, and it's usually just a cosmetic problem that grows slowly. Xanthelasma is the most common type of xanthoma, cholesterol deposits in the skin. It is more common in middle-aged women and is located primarily in the inner corner of the eye, most often on the upper eyelid. Approximately 50% of patients who develop xanthelasma have dyslipidemia, high cholesterol, or high triglycerides. Interestingly, only 1% of people with high cholesterol have xanthelasma. But researchers have found that having xanthelasma increases the risk of heart disease, heart attack, and stroke. So if you have xanthelasma, you need to have your blood tested and your cholesterol and triglycerides checked. Make sure they're not high. Fourth sign, arcus senilis or halo sign. As the name suggests, this is age-related. It occurs more often in older patients. It is caused by cholesterol deposits on the edge of the cornea and has this white or grey appearance that is visible above or below the outer part of the cornea. In some people, this shadow can take over the iris, the colored part of the eye. The person may notice that they used to have a dark eye and now it's getting lighter. Arcus senilis does not affect vision and does not require treatment, but there is a catch. When arcus senilis occurs in younger people, before the age of 45, it may be a sign that the person has severe dyslipidemia, very high cholesterol and triglycerides. In this case, it is associated with an increased risk of heart disease. If you're older and have a senile arc, it's normal. About 60% of people over 60 have it. After the age of 80, it's almost 100%. So don't worry if you're over 60 and look in the mirror and see a senile arch. Third sign, cyanosis. Cyanosis is the bluish or purple coloring of the skin. It could be that it's too cold outside and you've turned purple. It could also mean you have a heart or lung problem. If an area of your skin is cyanotic, blue or purple, when you're hot, it could be a sign that that part of your body is not getting oxygenated blood, which is red. It could be a blocked artery. Now, if the person complains of shortness of breath, it could be a lung problem, pneumonia, emphysema, pulmonary embolism, or heart failure, where the heart can't pump enough oxygenated blood. Of course, there are other heart causes such as congenital defects like tetralogy of Fallot, which cause cyanosis. Second sign, ulcers. Those sores that won't heal on the legs or feet can indicate poor circulation. It could be low blood pressure due to a blockage in the arteries that supply that area. Usually, the person won't be able to walk very fast because their legs get tired or sore and they get cramps. Most of the time, these ulcers are painful, but if you have nerve damage, such as diabetic neuropathy, you may not feel any pain. Arterial ulcers usually occur on the outside of the leg, on the heels and toes, and usually don't bleed. Other ulcers are venous ulcers, which are more common in people with varicose veins or venous thrombosis. Unlike arterial ulcers, they appear on the inside of the leg and usually bleed. First sign, swelling of the legs, ankles, and feet. This swelling or edema in the legs and ankles can be caused by a weak or enlarged heart, which causes fluid to build up in the body. You may feel like your shoes don't fit, your sneakers are tighter, your ankle feels fluffy like bread that's been baked, and when you squeeze, you get that dimple. You're more likely to notice this swelling in your legs and ankles at the end of the day because gravity increases the pressure on the veins in your legs. When you lie down and elevate your legs, it also reduces the swelling.